Hi, everyone, and welcome. I'm going to give everybody a couple of minutes to clear out our waiting room and for everybody to get situated. Make sure we've got everybody who was able to join, and then we'll get started. I do see a couple more people in the waiting room joining. As soon as we've cleared that out, we will get started. Okay. Good morning and welcome. Thank you for joining us today. I'm Jessica Levesque, and I'll be your host today during this meeting. I do have several colleagues with me from the department that we will introduce in a moment. Grace Roy is my co-host, and if I should have any technical difficulties, she will hop on and take over for me in the logistics part of it. So before we go ahead and introduce everyone, we want to go ahead and go over a couple of housekeeping rules. So everybody will notice that they are in listen mode only at this time during the presentation. You should have the ability to chat a co-host or the host during the meeting if there's a reason. We are recording this meeting in its entirety, and it will be posted on our Rate Reform website, which we will post that link in the chat during this meeting. Notice will be sent out within the next day, which will include links to this presentation at the Rate Reform site and links to our PowerPoint presentation. We will also post a link in the chat for you to be able to sign up for notices so that you will be able to receive any future notices for this meeting or anything else that you would like to sign up for. So we're going to move forward with the introductions. I'm going to hand it over to Jessica Miller.
Thanks, Jessica. Good morning, everyone. My name is Jessica Miller. I'm the Associate Director of Policy at the Office of Maine Care Services. And I want to thank you all for joining us this morning as we kick off our rate determination for interpreter services. These services are an important component of improving access to care for our members, and we really appreciate your participation in the process that we will be describing to you today. So with that, I'll turn it back to Jess for some more introductions.
Okay, thank you. Grace?
Thanks, Jess. My name is Grace Roy. I'm a financial analyst for rate setting.
Mandy?
Hi, Amanda Lee, rate setting coordinator.
Tia?
Good morning, Tia Boldick, policy unit, and I have oversight for Chapter 1, Section 1. Thanks.
And Hannah?
Good morning, my name's Hannah. I'm an intern with the rate setting team this semester.
Thank you. And I am Jessica Levesque. I am project lead from Delivery Systems Reform Unit at Maine Care. And with that, we will go ahead and start with our presentation. Mandy? So we are here today to talk about a rate determination for interpreter services, which is Chapter 1 of Section 1 of the Maine Benefits Manual. We've done our introductions. What we'd like to go over today is, for the agenda, we'd like to give a brief overview of the rate reform law, which is MRSA 3173-J. We'll talk briefly about the rate reform process, what you can expect the scope of the interpreter services project to be, targeted timeline that we'll be going over this, what the current payment structure looks like or payment is for interpreter services under Section 1. Then there'll be a time for comments and questions, and we'll explain how to come off mute at that time. We'll talk about next steps. Next slide. So the rate reform law is 22 MSR 3173-J, which is a standalone Maine law that was enacted in 2022, codifying the process and principles of the Maine Care rate reform system. So what this law does is it sets a schedule for regular rate review and adjustments. It ensures that there was a review of relevant state and national data to inform rates and payment models. It formalizes a clear and transparent process for a rate determination. This law established a rate system subcommittee of the Maine Care Advisory Committee, known as the MAC, and also a technical advisory panel known as the TAP. Next slide, please. So the rate reform process, not necessarily what this one will look like for interpreter services, but in general, a rate reform process, you can expect an interested parties kickoff meeting, which is what we're having today. And that process is to go over with you and meet your team, kind of see what the process is going to be and what timelines we're looking at and how maybe you can participate. So participation, that could happen during a data collection period of whatever's determined for needed for data collection. Then after data collection happens, there's a rate model development period, which our rate setting team, in this case, we don't have a vendor, it's being done in-house. So our rate setting team will develop some draft rate models. Once that's done, the model and the methodology and the rates will be presented in another forum. So that's a reason why you'll want to sign up for the notices, so that we always send out a notice when we're going to have a meeting. So it'd be a great time to sign up for that. After we present the draft rates and methodologies, we will then allow a period of time for public comment. So written public comment, and it will be sent in through email. After the department reviews the written comments, they will make a determination if there's anything in the comments that we would adjust the rates. Then we will post the written response to written comments on the rate reform website page. So that will be in the chat for you to be able to copy that. And then then the draft final rates will be done. And if we open up rule, or there's an opportunity or need to do rule proposal, then that will be done after. And I do have the rate reform website link posted at the bottom of this slide. Next slide, please. Now, I know this is a lot of information, so as I said at the beginning, we will be providing a link for you to be able to review these slides. So this is just basically several ways that a rate reform process approach can be. So if it's applicable, we would look at Medicare benchmarking. There could be other payer sources that we would benchmark again, like private insurance or other states' Medicaid agencies. And when that's not really appropriate for either one of those, then we will do a rate study. So a rate study is the data collection part and possible interactions with interested parties like yourselves to supply some information during the process. If that's the process that's determined for this study, you would probably be notified in a notice that would be sent out. Next slide, please. Okay, so scope of this project, we just wanted to be clear that there is a difference between interpreter services and translating services. So this process that we're talking about is specific for interpreter services that are found in the Maine Cares Benefit Manual, Chapter 1, Section 1.06-2. And so this is just a clarification of what the differences are between the two. Interpreter services happening in real time, in person, on the phone, video conferences are simultaneous and consecutive, whereas translator services that we're not going to be covering during this would be outside of real-time written materials or an opportunity to edit, proofread, and perfect the translation. Next slide, please. So the timeline that we're targeting, these dates are subject to change. We did send out a kickoff notice saying, an initiation notice saying that we would start this rate study. And so that was sent out December 16th, 2024. Today, we're having an external kickoff meeting to discuss what you can expect from this process and the time frame of it. Between now and the summer of 2025, there'll be a determination looking to see if there are benchmarks or if a rate study has to happen. And if there will be any participation, you would be contacted. By late summer, we're targeting to present those draft rates and draft methodologies back in a presentation similar to this. Then there would be the written comment period that I spoke of, that after you attend the presentation or review the presentation and would like to make comments in writing, you can. Then by early fall, we're hoping, if all goes well with the other processes, that we will be able to post a written response to your comments. And if there are any changes, you would see that in the written responses, if there was some made, and we post those to the website. And as I stated earlier, if there is a rulemaking process for this determination or study, that would happen after this process, late in the fall. Next slide, please. Okay, I'm going to hand this over to Grace to present this slide.
Thanks, Jess. So currently the reimbursement for interpreter services, Main Care reimburses $20 per unit, which is 15 minutes for interpreter services. That's code T1013. And this rate has been in place for at least the last 10 years. And I also wanted to just describe some of the service requirements. Interpreter services are covered only when provided in conjunction with another covered main care service or medically necessary follow-up visit to the initial covered service. When providers request reimbursement for interpreter services, the provision of interpreter services must be documented in the member record. Documentation must include a statement verifying the interpreter qualifications, date, time, and duration of service, language used, and the name of the interpreter, and the cost of performing the service. And providers of ASL interpreter services must be licensed by the Department of Professional and Financial Regulation as certified interpreters / transliterators, certified deaf interpreters, limited interpreters / transliterators, or as limited deaf interpreters. Thank you. Next slide, Mandy.
Okay, thank you, Grace. At this period, this was a short presentation just to give you a quick overview, as I've said, of what you can expect from this process with us. We're going to allow questions. I just want to go over a few ways that you can ask your questions to us. So to ask a question or comment, please raise your virtual hand and we'll call on you in order that your hand is raised. You can raise your hand by choosing the participants or reactions within the controls at the bottom of your screen. If there's anybody participating on phone, please press *9 to raise or lower your hand. We'll call on the name or phone number if a participant we'll request you to unmute your line. Through request will appear for internet users as a visual prompt on your screen. For telephone users, a recorded voice will prompt you to unmute your line by pressing *6. Once you're unmuted, please begin your comment by stating your first and last name, title, organization you represent, or affiliation. For example, if you're a Main Care member or a guardian or other interested party. We would ask, although we have plenty of time today, but if you can keep your comments limited to a few minutes so that we can give others the opportunity to speak. And at the conclusion of your comment, we ask that you please lower your hand. I'm going to turn it over to Mandy to call on people who might have questions.
Thank you. So it looks like Trisha Grant. I'm going to ask you to unmute.
Hi, I'm Trisha Grant. I am from Office of Main Care Services. I work for change management. I do contract configuration. I just want to ask, when on that last slide that you just spoke about on the reimbursement for T1013, are you referring to language or sign and oral on that slide?
Oh, that's a great question. Tia, do you know?
I can just put out that T1013 is actually paid two different ways. So not all services are reimbursed off the UCR at the rate of T1013. Language interpreter services is actually billed, requires an invoice to be attached, and those claims manually penned, and then those claims are reimbursed at bill charges with an invoice requirement. So I just want to make sure that we call out that there's actually two different reimbursements for interpreter services.
That's helpful, Trisha. Thank you so much.
Yeah. And will we be looking at restructuring both of these?
Okay, so what we are aware of in the rate setting department, I know you have the contract side, Trisha.
Yeah.
We are aware of the $20 for the T1023 code, or 1013 code, sorry. I don't know of another payment amount, but this is that we are looking for this code specifically.
So this code pays two different ways. So I just want to make sure I call that out, that T1013 is not reimbursed as a whole at $20.
That is up to the maximum amount of the rate.
So for language interpreter services,
right.
Language interpreter services billed with T1013 GT modifier require an invoice. Those services are reimbursed at billed charges.
Oh, okay, right. But up to the $20. I mean, we are reimbursing providers for hiring an interpreter for, and it is interpretation, because it's like, it's for a medical appointment. So they have to be, be able to.
So have you guys verified with the claims department that they're capping T1013 GT? Have you verified with them that they are not reimbursing the provider's bill charges and they're only paying up to the $20 rate?
Well, I'm sorry, I'm not in billing. I'm in the rate setting, so I don't know about the billing aspect of it. I do appreciate the feedback, Trisha, but I'm not sure. And this is something we can take back internally, obviously.
Yeah,
discuss,
I just wanted to point it out that we don't, right, as a whole.
Yeah, no, and I totally understand that. I just think it's kind of getting it's a little bit of a moot point at this juncture, because we're trying, I mean, this is a rate determination. We're trying to figure out like the best rate for it, not looking at how it's, necessarily how it's paid now. We don't have, the information that told us how it was determined in the first place. So this is just the kickoff. It's the start of it.
I just think it's important to identify that if we're looking for a rate structure on T1013, that we're just mindful that T1013 is not currently reimbursed at one rate.
Yeah,
Trisha, thank you Grace. Trisha, thank you so much for your comments. So it's really appreciated, and we will look into this. Thank you for raising that.
Sure.
looks like Barbara has a question or comment. Sorry, are you unmuted now?
Okay, yes, I've pushed the button. So I'm Barbara Millas, and I am an ASL interpreter here in the state of Maine, licensed. Now, I noticed on the slide that refers specifically to the requirement for payment through this process to licensed interpreters that the categories that were stated did not include one of the categories we do have here in the state of Maine, which is conditional interpreter. So again, I guess I'm looking to use Trisha's words just to call out the fact that either are we not including that group of licensed interpreters, or is that wording that needs to be added to this whole process to make sure they are included?
That could be language that we need to add. And this is part of the process where we want to take in, all of this feedback. It's just so helpful to be able to we don't know what the original one was based off of, but we want to make one, we want to see what the rate should be, and it's helpful to know that as well, because if we have to do, get into the policies and we have to update anything, then that will come with the process.
Okay, so just to say again, that to make sure that, we've made note of the fact there is this other category and we work at the same pace and level and, as any licensed interpreter. So it would certainly be completely logical that we would be included in that wording. So yeah, I'll be checking on that as we go forward. Thank you.
Thank you so much.
Not seeing any other raised hands. Trisha?
Sorry, me again. I should have asked. Will we be talking, or are you guys at all in this project looking into providers that are currently enrolled as main care providers that are also American Sign Language, and what the reimbursement is for that? Or are you looking just at T1013 as a whole?
That is something that we will be thinking about, Trisha, but we are aware of that. So thank you.
Okay. Thank you.
I just want to take a second to acknowledge some things in the chat.
Okay.
I'm not sure that we would answer this today. Is there an overall cap for how many interpreters? If you were able, Paula, is it Paula? Would you like to come off of mute and clarify more what you mean by a cap? If so, could you please raise your hand? We'll get back to you if you raise your hand. But another question is deaf interpreters, hearing interpreters, blind. Oh, okay, that's the clarifying thing in the chat. So we have that. I don't think that we can answer that on this call, Paula, but we'll take that comment back and we can look at that when they're developing the rate and methodology. Sorry, Mandy, go ahead.
It's okay. I'm not able to see the questions, just so you know, Jess. You'll have to read those.
Yep.
Danielle?
Hi, I'm Danielle Perfetto. I'm from Cool ASL Interpreting. I'm an agency owner, and we work with main care providers to provide interpreting services to their deaf clients, patients. And this might have more to do with policy than it does to do with rates, but I just figured it was worth it for me to throw it out there. Recently, we've had a scenario where it was very challenging to provide the interpreting services for a main care covered program. It was an intensive outpatient program, and it was 3 hours in duration each time. And currently, it seems like the only way for there to be two interpreters is if one of the interpreters is a deaf interpreter. The wording doesn't seem to provide for interpreters, like a team of hearing interpreters, which is, industry standard for anything over about an hour, needs a team of interpreters. That combined with the wording in Main Care's policy to not pay for reimburse for travel time made it very challenging to provide the interpreting services for this deaf person. So that's something that really needs to be looked at, I think, and updated. Along with, and I just wanted to second, I know this is also probably wording and policy, but what Barbara had mentioned about the wording for which type of interpreters are covered. Recently, the Department of Professional Licensing did an overhaul on interpreter licensure, and there's new wording being used for several different things, and conditional interpreter is one of them. So I think it definitely warrants a look at rewording the policy for main care interpreting services.
Thank you so much for that feedback. That's exactly what I'm talking about. Like, this is the kind of information that's going to help us so much, I think, with the data collection and everything. So thank you so much.
Yeah, thank you.
Edward.
Can you hear me now? Yeah, my name is Edward from Delight Care Services. So we are a main care provider for in-home care services, but we've got a team of interpreters, and myself, I'm an interpreter. We work with other agencies. So I'm wondering how we can become a main care provider for languages. Do we need specific enrollment, or is there provision in the current enrollment which we have for in-home care services?
Actually, that's a good question. I'm not sure about the in-home services. Let me take that back, and we will come up with some more information.
Okay.
So basically, you were asking about being allowed to enroll as an interpreter with main care.
Yes.
Oh, okay. Sorry.
Yeah.
So that would be.
I'm a main care provider for in-home care services already, and I'm wondering how can I enroll for language services, of which we have the capacity and the competencies to provide the service.
Oh, okay. So you would have to reach out to, well, you can reach out to us and we can help connect you to our enrollment, main care enrollment. I don't think we have anybody on the line right now just because I wasn't sure how they would fit into this meeting, but we can definitely get you set up to the right place.
Thank you so much.
Of course.
Yeah.
And before we do, I'm sorry, Mandy. I just wanted to clarify that we had a question in the chat. Today's slides will be made available at the Rate Reform website, and that will be sent, the links in a notice that will go out within the next day. And we have also posted the link to the Rate Reform website page in our chat.
And I just, sorry, I just wanted to clarify was it Ben? Sorry, I don't know where you went. That we don't currently have interpreters themselves enroll. Right now, you would have to work with your main care provider, I believe. The main care provider's enrolled, and then they reimburse the interpreter. So at this time, We don't enroll interpreters,
Oh.
but that is good
Oh.
feedback.
Thank you, Mandy, for that.
Yeah.
I appreciate it. I don't know as much about the enrollment process and how to enroll, so yeah.
Trisha?
I just want to add on what Mandy said for Edward. Right, we don't enroll interpreter services. We don't enroll interpreters as a provider type, but all main care policies allow the T1013 billing. So you should probably talk to your provider relations specialist. They can help you to actually be reimbursed for the T1013 services that you are providing for the member. So we don't enroll interpreters because we allow the T1013 billing to be billed by main care providers that are enrolled as what they are. So you should outreach them and they can help you bill those T1013s and get reimbursed.
Thank you, Trisha. Any other questions? Or suggestions? Or pain points?
Okay, I do have something in the chat. Are you working with strategic plan being created with Innovi? I'm not familiar with what that is, but
Me either, Jess.
Paula, I can let me see if I can ask you to unmute. Not to put you on the spot, but he'll be your opportunity to unmute.
Perfect. Thank you. Hi. I'm Paula Matlins. I'm from Mobius Incorporated. I am the Director of Non-Traditional Communication and Deaf Services. And my question is, there's a strategic planning group that's coming to the state of Maine that was asked for by Governor Mills. And I was wondering if your group is working with that group and the strategic plan that they are developing. Thank you so much for your time.
That with was that Bill Waters? Was that I can't remember if we have met with them already, but I have heard that there is a group, and so we're trying to, see the I think there's going to be a report being made or something like that. We are, we're in conversation with them. I think we did invite some of the people that were working on that report to this meeting today. I'm not sure, however, if they were able to show up, but it is intended to keep them in the loop and to, use their information as we find it as well.
Thank you. Barbara.
I was going to help to clarify Paula's question, but I see that Sam is next, and I'm going to defer to her because she is from Innovi. Thank you.
Okay. Sam, you should be all set in a second. There you go.
Hi, I'm going to use American Sign Language as long as the interpreter can see. I'm Sam Waltz, and I'm from Innovi Strategies. I'm from the team, and so thank you for the invitation. And thank you, Paula, for sharing that this meeting was happening today. Yes, briefly, I would love to share. We're partnering with Department of Health and Human Services and have been since September, focusing on the interpreter needs assessment in the state of Maine and really tracking to see what's happening within the state around the interpreting shortage. So really, we're in phase 4 at this point, the final phase of this project. And as we have the data at this point, we're focusing a number of different community members throughout the state of Maine to work on work groups to find solutions to address the interpreting shortage in Maine. And so this definitely includes healthcare organizations as well, because we see many issues within the data that we've collected. And so we would love to continue to partner. We'd love to be involved in your rate setting work and to share the information that we have collected along the way, and also invite you to be a part of our work groups as a stakeholder. So really would love to engage in a partnership around this work. And so it's an open door to reach out, and please do ask if you have any questions.
So much.
Thank you, Sam.
I'm not seeing any more hands. Do we have any other questions?
As we give a minute for anybody, you can still think of those last minute questions, but I'm going to ask if Mandy would put up the end of the slide deck, please. So as we're winding down on the call, I wanted to post what our next steps are, and also post some contact info on the last slide of the presentation for you. So next steps will be compiling some data, looking to see if there's benchmarking, looking to see what's in the rate, and like clarify some of the stuff that Tricia was talking about on the call before we move forward to the next part of the process of determining. So that will determine if we're going to do a rate study or a benchmarking that was described earlier in this presentation. There could be meetings that come out of this, as we've discussed, and some notices will go out to ask for some participation from all of you or others that you want to include at that time. So I wanted to clarify that to be sign up if you're not signed up already for notices. That was posted in our chat, how to do that if you're not already signed up. And then thank you, Mandy. If you could go to our last slide while people decide if they've got more questions for us. And I wanted to call out that if you have any questions after this meeting or as you're reviewing this presentation, go ahead and send that to this email address for Grace Roy, who currently is the project lead for this. And we did post Grace's and myself's emails in this chat. Thank you, Mandy. We can take that down and look to see if there's anyone else with any last minute questions before we go. Okay, I just would like to remind everyone that to be looking for the notice, that you'll be able to get the links there to the PowerPoint we've shared with you today, and also this presentation that the recording itself, so will be helpful to review, and a transcript. As not seeing any more hands raised, I'm just going to Jessica or Grace, do you have anything to share before we let everyone go? Any last?
Just want to thank you all for joining us today and really appreciate the feedback. And we'll look forward to working with you all.
And I just echo that. Thank you all for coming. It's really appreciated.
Okay, thank you, everyone. Have a great day. We look forward to working with you.